Hello, colleagues. I am truly sorry I couldn't join you at the event and the conference as I am currently unable to leave Israel due to the ongoing war, but still I am really grateful for the opportunity to speak with you about AnteAGE and its remarkable role in skin regeneration, because in my view, AnteAGE is a powerful and essential tool that should be part of every dermatological and aesthetic medicine practice. Just a brief introduction. My name is Guy. I'm a medical doctor practicing aesthetic medicine in Israel. I hold master degree in aesthetic medicine and postgraduate diploma in clinical dermatology. I own two clinics in Israel, and I also practice aesthetic medicine in the plastic surgery department and in a big health organization called Mu'chedet Health Organization. I have the honor of serving as an international trainer for AnteAGE as well as of other international aesthetic companies, as you can see in my disclaimer. In order to understand what is anti-age and its power in regenerative aesthetics, we must speak about skin aging. And speaking about skin aging, we know that we are individuals and we have different genetic expression. Our skin behave different. But what is common to all of us is that all of us age, and aging in the skin and aging of the face is quite predictable because we know the characteristics that result in skin aging. We know, for example, that cells in the skin become senescent. What does it mean, senescence? It's the intrinsic aging of cells. It can be with fibroblasts, but also with immune cells, melanocytes. All cells in the skin become senescent, become dysfunctional, and present some dysfunctional states of cytokines and communication molecules, what we called in a group senescence associated secretory phenotype. But it's not only the senescence, because in our skin we have stem cells, and with age the stem cells get depleted. We have less and less stem cells in the tissue. For example, adipocyte stem cells, they decrease with aging. Together with the senescence-associated secretory phenotype and the depletion of the stem cells, we also have, as a result and parallelly, dysfunctional intercellular communication because cells speak together. They are always speak with each other to have some function. And we know that cells speak both with cytokines and growth factor and molecules, but also, for example, in the slides in front of you, you see that melanocytes sometimes speaks like neurons, so they have some communication. And with age, there is dysfunction or miscommunication between cells. Adding to the intrinsic aging, we are constantly exposed to extrinsic environmental factors that result in extrinsic skin aging. And what does it mean, extrinsic skin aging? So generally, it leads to some chronic pro-inflammatory state. Our macrophage become polarized into macrophage type 1, and it means that they are expressing and secreting inflammatory marker, but they are doing it constantly because of overburden due to the increased reactive oxygen species in the tissue because of chronic UV damage. So this state of chronic inflammation with aging, we are also name inflammaging, and together with the intrinsic senescence of the cell, we have a chronic state of aging that it is resulting from all of these factors. The question that all of us should ask ourselves is, can we really rejuvenate skin extracellular matrix? We really change the environment in the extracellular matrix to affect cells or to make cells behave younger, to change their environment for younger communication? And the answer for that is yes, because today we know how to mimic young stem cells that know how to proliferate, how to replicate, and how to effectively communicate with other cells in the tissue. We can do it with the poly-GF technology. We can synthesize synthetic, however, completely biomimetic and 100% copy of the normal growth factors, of the human growth factors that are secreted from stem cells. And we can do it and thereby affecting the cells to think that they are living in a young extracellular matrix. And this product is the first product that I will discuss today, called also the growth factor solution. However, for anti-age, we have three different solutions. We have the growth factor solution that is optimal for fibroblasts. However, we have two other solutions with growth factor that are specific either to the hair follicles, we call it hair solution, or combined with tranexamic acid, thereby is better for brightening solution and for melanocytes. If we take, for example, the brightening solution, so together with the anti-inflammatory growth factors like TGF-beta and interleukin 10, it also contains tranexamic acid, which is very important active substance that decrease plasmin activator and affect melanocytes. And if you are treating some melasma or skin hyperpigmentation with laser, like I do, I always combine it with brightening solution that contain tranexamic acid as well as anti-inflammatory cytokines that rejuvenate the skin, decrease senescence, and decrease pigment production. Similarly, when I treat hair and I want hair regrowth, I want all the growth factors that are specific for changing cells from telogen into anagen state, thereby creating or leading to some hair growth. And these growth factors are specific. It's not just a growth factors that we can find in the blood when we are producing PRP. These growth factors, like Nugin, for example, are special. They are mimicking young stem cell environment that result in hair follicle proliferation and expression of anagen markers. But cells usually are not communicating with just normal molecules. Cells are not doing some extracytosis of growth factor, but they communicate with extracellular vesicles. If one cell wants to speak with another cell, what it is doing, it is secreting the growth factor with part of its cytoplasm and its membrane by a process called exocytosis. And the other cells get this feedback by doing endocytosis for all of these vesicles, together with a growth factor inside, but also with other markers. And what we call these extracellular vesicles in the aesthetic medicine industry is exosomes. Exosomes are essentially this growth factor inside this bilaminar lipid layer, which mimic the original communication between cells. And if we are speaking about human mesenchymal bone marrow stem cells, yes, it secretes extracellular vesicle, and we called it exosome. But exosomes are not containing only growth factors. They contain also microRNA and messenger RNA, some DNA molecules or RNA molecules that also create some stimulatory effect, but also increase protein synthesis and creating many other different functions. And if we are speaking about anti-age exosomes, the exosomes of anti-age are hybrid. They contain both bone marrow stem cells exosomes and umbilical cord stem cells exosomes. And the reason for it is because stem cells behave different. When we are looking on bone marrow stem cells, most of its exosomes result in regenerative function, in proliferation of other cells. And they are really effective in decreasing inflammation and upregulating the antifibrotic regenerative state. But the stem cells from the umbilical cord are younger, so they create in better differentiation of cells and some function that are suppressing some aging or some senescence of cell. So getting them together in anti-age exosomes, we have different molecules, and all these molecules, all of these exosomes behave different and result in different expression and different change in cells. And if I need to compare anti-age exosomes to plant-derived exosomes, it is a whole new world. It's completely different because plant-derived exosomes do not contain growth factors. Growth factors produced only in human. Plant-derived exosomes contain microRNA, this RNA expression, some protein, maybe some lipids, some mRNA, but they do not contain growth factor, especially not human growth factors, which are very important for regenerative medicine. So using a plant-derived exosome is not mimicking, and it's not like using human-derived exosome, because real exosome needs to be a particle that is absorbed by the cells that need to absorb it, or by the human cell, or by the skin cells that we are working on. And in order to be absorbed, they need specific size. Exosomes need to be in around 100 nanometer of size. They must contain lipid bilayer, and they have to have the positive and negative marker of exosomes. For example, CD9 and CD81, they also have to have the negative, like canalexin. All of these markers are mimicking, or they are deciding if the exosomes, or if the molecule and if the particle that I'm looking on is real exosome. But most importantly, particle that is name exosome, it's not just name exosome, it should behave like exosome. And it means that the cells need to integrate it. The cells need to get it into the cells, or it have to have this endocytosis. And in this study, what AnteAGE did, what Celeste did for AnteAGE exosomes, is they checked the fluorescence uptake by labeling of labeled exosomes into fibroblasts, and they saw that not only the exosomes get into the cell, but they also sit in perinuclear localization, which means that they are functioning. And we can see this function because when we are taking exosomes and put it into cells, we see cell proliferation. We also see some decrease of inflammatory marker, which means that they have some healing effect or some regenerative effect. But the question that I want to ask all of you is different. Because exosomes, real human exosomes, are not legal in the Western world. The only place that it is legal is in the US. If we are looking on the Asian market, if we are looking on the European market, exosomes are not legal. But the question that I want to ask you is if one of you out there in the audience know the difference between natural diamond, real diamond, into laboratory diamond. Which one of you can really see the difference between neutral diamond and laboratory diamond? Not in the lab. If you are looking on the diamond, do you see any difference? For example, in this picture, it is the exactly opposite way around. So whoever thought that she or he recognized what is real diamond probably didn't. And the cells of our skin are not recognizing real or perfect synthetic molecule as well. And this is biosome. Biosome is the first synthetic human stem cells like exosome. So what we get a molecule, we get a particle that is identical to the human stem cell exosome. Our cells in the body do not see the difference, but there is a difference that all of us should know. And the difference is the growth factors that are inside. Because in biosomes, we don't have any mRNA, we don't have any circular RNA, we don't have any RNA or DNA product. We have only growth factor. And not only we have the growth factor, we are selecting the growth factor. We have the growth factor that we want in the amount that we want. Their size is completely similar to exosomes. They also have the same 100 nanometer size, and they also contain this bilaminar lipid layer. They mimic human cells membrane. And this is why our cells do not recognize them as synthetic. They are integrating them and they are putting them into perinuclear localization, which result in their migration. We can see the comparison between biosomes to the real exosomes, both of bone marrow stem cells or bone marrow stem cell like. And we see that the migration into the wound of fibroblast is completely the same. But it's not only the migration, it's also fibroblast proliferation and epithelial cell proliferation, and even the end collagen production. Our body do not see any difference between perfect match or perfect copy of the stem cells exosomes. And this is really the power of the biosomes because it's not only mimicking the real exosomes, it is controllable. I can decide how many particles I want. It is predictable because if I decide what particle I want and I decide the amount that I want, I know that the effect will be there. Exosomes are heterogeneous. If I'm using PRP for growth factor or real exosomes, and especially if I use plant exosomes, all of them are unpredictable because I do not know what was the condition of the manufacturing of the exosomes and what the cells want to express. But using biosomes, I have controllable and predictable effect. But most importantly, specific effect, because I choose the growth factor. So I can choose the growth factor that are affecting hairs, like in the hair solution, and I can choose the growth factors that affecting the melanocytes and combine them with tranexamic acid for even more effect. And together, I can create a very, very strong stimulatory effect or rejuvenating effect. But stimulation, real stimulation, is not only waking up cells because we are using different variety of light source, heat source, mechanical source, chemical source. It does not matter which modality you use for stimulation. Real regeneration is not only stimulation because it depends what is our goal. If our goal is healing, no matter what energy-based device I'm doing, I want regenerative conditions. If our goal is to deliver, then I will choose some energy-based device only to deliver and rejuvenate the extracellular matrix. But sometimes our goal is both to create high inflammatory effect or control the inflammatory effect with energy-based device, and also to decrease the inflammation in the second stage of the wound healing stage and increase regeneration. So I combined exosomes, biosomes, growth factor solution, brightening solution with all different modalities, both injectables and energy-based device. And I always think, what is my goal? Do I use the growth factor or do I use the biosomes for healing? And then I will use it even after ablative fractional laser and everything. Do I want to really just deliver the solution, deliver the biosomes to rejuvenate the extracellular matrix? Then I will use microneedling or simple device. Or if my goal is combined, if my goal is both to deliver but also to rejuvenate, then I will use some soft energy-based device in between, like TMFI or non-ablative fractional laser. Because after every stimulation, we have a wound healing effect composed of four stages, right? The first stage, which is hemostasis and bleeding. The second stage, which is inflammation, then proliferation and remodeling. We want the inflammatory state to be as fast as possible to go into proliferation and remodeling as fast as possible. So I use different energy-based device, no matter what energy-based device you use in your clinic for delivery, all of them fits for exosomes, biosomes, and solution. You can use non-ablative device like the 1550 nanometer erbium glass or the thulium laser. You can use ablative device like the CO2 or erbium YAG. It's your decision if you want to use laser-assisted device or just microneedling or TMFI. Only think about your goal because exosomes are really powerful. Biosomes are even more powerful in regeneration, in regenerative effect, but also in healing effect. So you can combine it in every protocol that you have. The only thing that you need to remember is how long your channels are open and for how long you can use the product and create some delivery. So, for example, if I want long-lasting delivery and if my patient is using also home product with biosomes or home product with solution, with growth factor solution, then I will use some long-lasting channels like TMFI or CO2 laser. If I want to just deliver on the spot, I might use the thulium laser, much softer, faster healing, and good delivery. Because biosomes are actually exactly that. They will result in proliferation in regeneration, but they will also decrease the inflammation and increase M2 polarization, thereby decreasing the damage inflammation, decreasing the matrix metalloproteinase, decrease the inflammatory marker, and increasing the regenerative factors, increasing the regenerative cytokines. This is why they are so powerful in all protocols. I'm using biosomes when I'm treating atrophic post-surgical scars. This is only two treatment, soft parameter with TMFI only for delivery. And you can see how dramatically the scar changed, the texture, the difference in the tone, because when the skin behave better, all the cells behave better, but it's not only with atrophic. When I'm using on hypertrophic scars, I get completely change of texture. No more redness, no more pigmentation, no more surface irregularities. Everything become much better. And also the symptoms. So for example, I can combine the growth factor with corticosteroids to even decrease more the inflammation in some hypertrophic post-surgical scars that are itching and uncomfortable. And I can, of course, combine the brightening solution when together with the regeneration, I want to also decrease the pigment. So this is a powerful tool that I can adjust to my protocol, adjust to the energy-based device or the tools that I have in my clinic in order to get a good effect. And the healing is very fast. I can use it on every Fitzpatrick in every place in the body. This is Tria Distense. And you can see how dramatic the change was even after one treatment. And it is because the regenerative power of combining anti-age biosomes together with the technologies that create some stimulation or some regeneration. So in my clinic, for example, when I want skin rejuvenation and when I want skin remodeling, I'm combining injectables. Of course, I use biostimulators. Of course, I use fillers, Botox, and some mesotherapy, but I always combine it with some regenerative products like the biosomes, and I deliver the biosomes by mean that I have in my clinic, and I get a wonderful effect. So, for example, in patient that needs to have lifting, I will work with HIFU on the deep layers in order to create some lifting effect. Then I will inject biostimulators like the PLA in this example to create some stimulation of inflammation, but I will always finish with the delivery of this active substance, regenerative substance of anti-age solution or biosomes in order to have perfect regenerative environment. And I can do it all over the body, not only in the face when I'm regenerative hand, and when I'm doing it also for the neck, I have completely different skin because stimulation is not enough. You want also regeneration. You want decrease of inflammation, anti-inflammatory environment, decrease reactive oxygen species, proliferations of cells in order to get real good, long-lasting skin regeneration. Similarly, when I treat post-acne scars, of course I'm doing subcision. Of course I'm cutting all the septors and fibers that are creating these post-acne scars. But always after, I will deliver solutions or biosomes in order to have regeneration, in order to have new skin, functioning skin, and better skin. And when I'm saying functioning skin, I'm not just speaking about changing of texture, also redness, also pigmentation. I want new skin, and new skin require regenerative products. Similarly, melasma. Of course, I treat melasma and dermal pigmentation, post-inflammatory hyperpigmentation, and every pigmentation that results from skin senescence and misbehavior of cells. Of course, I use lasers. Of course, I use mesotherapy, but I always combine it with biosomes because senescence is the number one factor that create all of this effect. No babies are born with melasma. Melasma create with aging. Of course, melasma is complicated pathology. Of course, we cannot be cured for melasma. And there are many factors that contribute for melasma and dermal pigmentation. But all of them are also combined with senescence. So when I'm working on the peri-orbital area, very hard area to treat, but I will always combine together with some other technology, but I will always also use the biosomes, especially for maintenance and have constant and long-lasting effect. But not only for long-lasting, also for induction. Because when I'm treating melasma, and this picture is not the result of this patient, but it's just to show you that in 1 month, I can dramatically change melanin presentation, melanin expression, and with just one treatment of laser in melasma, 1064 nanometer, you cannot really create this effect because this effect is result also from changing of vascularization. All skin behave better. When speaking about hairs, exactly the same. Because when I want the hair to grow, only in the hair of in the skull, but also eyebrows, I need to use regenerative products. Even if I use only home care regenerative products, I will get really good result. And this is from a clinical trial done only with the home care. But when I combine it in the clinic together with microneedling and application of exosomes, and biosomes and growth factor solution, as you see in front of you, then I get better result, faster result, long-lasting results in every hair, long hairs for females, in seborrheic dermatitis, and everything that is resulting from non-functioning cells. So if I want to conclude my talk and give you some take-home message, the first thing that I want to say is always combine regenerative products in your protocol because senescence and skin aging is the leading factor for all the aging pathology that we see on our body and especially in our skin, in our face. But if you want to use regenerative products, make sure that you use regenerative products that work. And if you want them to work, they need to be derived from human and not only from human, from really young replicating stem cells. But if you need it and you want to use it legally, you must use synthetic product. And for me, AnteAGE serve exactly that. Because for me, I don't know any other product that is so much validated, but still synthetic, mimic human stem cell, very, very good. And we see it by functioning test. But it's not only that, it's amplified and targeted for the indication. So thank you for listening, and I wish you a successful and inspiring event.